Everything we're doing is helping to flatten the curve. That's the promising news from state health officials today. But health officials say, as for reaching the peak, we aren't there yet.
We generally do not know that we have peaked in the state until we see about a 2 to 3 week decline in all of our data indicators. And we have not seen that yet.
New modeling suggests our projected total COVID-19 deaths could drop by 60%. But the governor says we can't let up since the cases keep coming in.
That's really good news, but people need to understand in that model, it is modeled on the assumption that we will continue to keep our nose to the ground here and our shoulder to the wheel. If we let up, that number's going back up again on fatalities.
So what will it take for state health officials to start easing restrictions after the peak? Secretary of Health Dr. John Weisman says we need enough personal protective equipment for frontline workers. We need quick availability to test people so they can be isolated. We need enough hospital capacity, and we need enough capacity to quarantine people who can't safely quarantine at home.
So those system pieces are going to be incredibly important as we move forward. And we'll need to be thinking about how we carefully reverse engineer lifting some of these community mitigation pieces.
Do cloth face coverings prevent the spread of COVID-19? The state health department says while there is limited evidence showing that using cloth face coverings helps reduce disease transmission, however, they can reduce the release of infectious particles into the air when someone speaks, coughs, or sneezes, including someone who has COVID-19 but feels well. Health officials say wearing face coverings will not prevent spreading COVID-19 without other protective measures like great hand washing and staying away from other people. So, how do I wash my cloth face covering? Health officials say wash your cloth face covering after each use or at least every day. You can wash them in the washing machine with detergent and hot water and dried on a hot cycle. Health experts say you should throw away face coverings that no longer cover the nose and mouth, have stretched out or damaged straps, cannot stay on your face, have holes or tears in the fabric.
Across King County, Metro Transit has reduced service nearly 40% amid the COVID-19 crisis. Tonight, public transit workers are calling on the county for urgent measures to better protect themselves and the public.
We sent this open letter, and it is born out of frustration, a sense of urgency, and anger.
This letter delivered today calls for a reduction of hours, full PPE for workers, and transparent reporting of COVID cases to frontline workers.
Not notifying me that I've possibly been exposed to coronavirus doesn't jeopardize the health and well-being of just me and mine, but also the public at large.
The transit union says there are confirmed cases among Metro Transit drivers. A video message from Detroit bus driver Jason Hargrove has hit local transit workers especially hard.
For you to get on the bus and stand on the bus and cough several times without covering up your mouth, that lets me know that some folks don't care.
Just days after Hargrove posted this video, he developed COVID-19 and died.
What he said, it just sort of, he said everything that I've been feeling. This is what's really going on.
Transit workers say they desperately need full PPE, better sanitation, and safe practices training for all workers.
The quiet streets, the mask we're wearing, the social distance we're keeping, it's helping. But our state health leaders worry about a mixed message.
We do continue to flatten the epidemic curve in Washington, which is great news. But we can't let this news make us complacent.
We want to crush the curve. And despite new modeling that suggests our projected total COVID-19 deaths could drop by 60%, the cases keep coming.
We're still getting, 400 new cases a day.
That's why state health leaders in today's briefing emphasized their efforts to secure millions of PPE items, from gloves to gowns, masks to shields. They said vigilance remains the word.
We are nowhere near being out of the woods here, and this virus can easily spring back.
Tracking the cases is critical to understanding the deadly virus and beating it, but try tracking it on the Department of Health website. And you know it's been a challenge, hiccups and slowdowns, updates posted at different times. Yesterday it was 6:30, today it was 3:30. Last week there was a 3-day lag. And then you look at a state like New York getting clobbered by COVID, and yet their data reporting faster and much more detailed. Same goes for Louisiana. They post every day at noon, and like New York, they offer other metrics like hospitalization, even underlying conditions. We don't do either. The state told me the site got overwhelmed. Updates have been made, including this interactive map, and they hope to add other metrics.
And we are now asking hospitals to report COVID confirmed cases and are looking to link that with other data.
The other thing you might notice on their site right now, they are not reporting any negative test results. They say that's because it actually what overwhelmed the system and it was really bogging it down. They're working with their vendor. In fact, they've got another tool, so they are tracking it. They're just not sharing it. The other thing that we ask that so many of you want is you want to see that recovery data. The state does not post it. I asked them today if they would. They didn't answer that question. We'll keep asking it. But I did look at Worldometer today for you just a few minutes ago, and 302,000 people have beat COVID-19. They have recovered.